Hello, my name is James Wardell. I'm a doctoral student at Idaho State University, and this semester I'm participating in a career path internship, creating a custom ChatGPT for our public health agency. So my first experience with this idea came in 2023 when I saw an interview with Satya Nadella the CEO of Microsoft, where he's talking about an early version of ChatGPT that they were testing in India that learned all of the government forms and the several dialects of languages. And a rural farmer was able to interact with this ChatGPT and find out about the government subsidies for his farm and actually have the bot help him fill the form out in his natural language because the form was in a different language, and even helped him submit the form to the government in the correct portal, something he never would have been able to do before, nor did he have any technological experience. And so at that point I realized that it had a possibility to help bridge the gap between consumers of government services and those that provide them. So I want to bring some definitions up before we get too far into it. And of course, since I'm using AI, I had to have AI generate these for me. So what is a GPT? It's a generative pre-trained transformer, and it's an AI model designed to generate human-like text based on given prompts. It learns from vast amounts of text data and can perform tasks like answering questions, writing, and summarizing. A large language model is a type of AI trained on massive text database to understand and generate natural language. GPTs are a specific example of LLMs. And ChatGPT, of course, is an application of a GPT model optimized for conversation. So ChatGPT, even though they coined the phrase, is the technology, not necessarily just the brand. So what I am building is a custom GPT. And a custom GPT allows you, in natural language, to wrap around ChatGPT your own context window with documents, your own guardrails of rules of what it should call itself, what it's allowed to talk about, what it's not allowed to talk about, how it can respond, what things it's allowed to produce. And so basically, you can format these in any way that you need, and you don't need to know code. There is no coding involved. It is just putting in text and your context information. So I wanted to talk about the timeline of ChatGPT just for a minute, because it's kind of crazy. Right now, on May 13th, 2024, 4.0 came out, and that's what my system is using. And 3.5, which was the first public release of ChatGPT, came out in 2022. The next major release was March 14th of 2023, and they just released 4.5 February 27th of this year. So in 27 months, we've had 4 major releases. And in fact, Mo Gaudet, the former CEO of DeepMind at Google, says that these models are improving, doubling their intelligence every 5.7 months. So imagine if your intelligence doubled every 5.7 months since you were in high school, because that's about the level ChatGPT 3.5 was on an intelligence scale. And if your intelligence was doubling every 5.7 months since then, you would be pretty smart by now. So IDASense Food Safety is what my custom chatbot is called. And essentially what went into it is the custom instructions, the Idaho Food Code, other departmental resources, guardrails, no web search, so it's not allowed to use the internet, and the latest FDA guidance. So if the Idaho Food Code doesn't have a specific rule about it, because it is a little out of date, we use 2021, I think, or that's the FDA one. We use 2013 in Idaho, and so if the Idaho Food Code does not address it, it will look for the FDA guidance and say, Idaho does not have a law about this specifically, but the FDA recommends that this is what you do. So how does it work? It provides answers based on the Idaho Food Code and other regulatory documents. It generates custom training materials for employers. It offers personalized scenario-based learning for employees. The user experience, it's very simple interaction for users. You ask questions, request training documents, You can simulate inspections with the vision mode and actually use the camera to look at your walk-in cooler or your freezers and get feedback on whether you have stacking order problems or other things that are violating the code. So it has a strategic public health impact, and it increases access to the public health department. Idaho's public health department has very limited resources. Their inspectors are expected to inspect somewhere in the range of 200 establishments per year, and that's pretty insane. And so they don't have time to do training or outreach or community involvement in these businesses. And so this creates a way for people to get connected. It also gives people 24/7 access to these tools, to the documents and the code in 50+ languages. Currently, the Idaho Food Code is only published in English and kind of in Spanish, but not officially. And so now, if you go on there and you start chatting in Spanish, Mandarin Chinese, Farsi, Arabic, it will automatically translate the code and continue the conversation in the user's preferred language. So it's a scalable public health outreach. The template for IDASense can easily be expanded to other public health policy manuals and areas. The template that has been built, it'll be very simple to put in another department's manual and simply change the name of the bot and a few instructions and be ready to go. And we hope that it'll improve training effectiveness. A lot of small business owners in Idaho who open an establishment may not have a lot of food service experience, especially like in a grocery store. And so giving owners the option to learn how to train better and get better training materials, I think is really important. Because the chatbot is so easy to use and the training access is free, they don't have to pay for it. You don't have to sign every employee up to a service. They can just download ChatGPT, install the free chatbot, and they have it. It also promotes a culture of food safety by allowing people continuous access to the information. If you have an employee who's not sure whether they should be doing something or not, they may not want to go to their boss a year after they started their job and say, is this wrong? So if they can pull out their phone and get that information, and also for employers and business owners, they're not going to want to call a regulator and say, I'm doing this thing and I'm not quite sure if it's going to be okay or not. But if they can get that feedback without risking a regulatory pushback immediately, that I think will increase the food safety. And it also is going to have long-term public health benefits. If we can increase compliance with food safety regulations even a little bit, we can reduce the number of foodborne illnesses. And same with the regulatory compliance, kind of what I've already been talking about here. So, that was actually, okay. So, I'm not sure if I've gone over my time yet or not. Okay, so what I thought I would do with my last couple of minutes is actually just kind of show you what it does and how it works. So give me just a moment here. Don't think I like this laptop very much. Yeah, not a fan. Okay, so we're gonna do it. Well, I was going to try to just bring it up, but I would have to log into my actual account. So I'm not going to necessarily do that. But I will send you all the link to the ChatGPT itself, and you can try it yourself. But to just share kind of a couple of fun experiences with this, when I first approached the health inspector that I've been working with, I managed a grocery store before I went back to graduate school. And so I noticed a need in this area. It was part of what made me want to do this. And I went to her and I said, I have an idea for this tool that will let people access the food code from their phone in natural language, and they don't even have to speak code, like they don't need to know the legalese, and if they're not even sure what the right words are, it'll figure it out. And she's like, I have no idea what you're talking about. It's literally what she said. I have no idea what you're talking about. I've never used ChatGPT, but sure, go for it. And so she just signed off on it and has kind of let me run with it. And last 2 weeks ago, I got to go to the statewide convention of all the health inspectors and release it publicly. And it was really cool to see the different ways that the different health inspectors from all around the state saw ways that they could use it. Already, they've come to me and said, I've got a couple of businesses I know exactly that are going to love to use this. I've got, my inspectors themselves are saying they're using it while they're going out on inspections. If they can't remember where the specific code is, or if it's something that only comes up rarely, they can find it very quickly, saving them a lot of valuable time and energy. So I think that this actually is going to create a savings for time and on the inspecting side as well. In fact, to that end, we're working on creating an inspector bot that will have all the same information, but also has their entire inspection form and all 350 citations that they can have. So if they see a problem, they can explain the problem, and the inspector bot will say, that's item 7, sub item 15. So they don't have to spend so much time going through the computer trying to find the right place. My final point that I'll make, we are hoping to expand this really big. I got to meet the National Executive Director of the National Environmental Health Association. The cost of running these GPTs is $600 a year, regardless of how many you have. That's the cost of a billboard. So it's pretty easy to do. We're hopefully going to get the National Environmental Health Association to pick up that tab and make this a national project where any health department or public health agency throughout the country could host their chatbots for free through the National Environmental Health Association. So my goal is that in the next year or so, we'll have a template that will be freely and publicly available to public health institutions to be able to implement this tool. So yes, right now we're moving into out of the very small beta testing phase, and part of why I wanted to bring this to MPSA is I'm going to be working on designing an actual quantitative study to look at outcomes. So that's where I'm at now. I wanted to build the tool first and have the tool in place and make sure that it was functioning properly, because I didn't want to run into a problem where I did the quantitative research and the problem with the quantitative research was the tool failed. So we're kind of moving into that stage now, and I'd love your feedback on some of that too, now and after the conference or in any way, and I'm happy to take any questions you have. Thank you.